The race between infections and injections is a shuffle, not a sprint, led by the over-80s, including the man behind housewife superstar Dame Edna Everage.
I'm an out-of-work actor, and I've had to give the performance of a lifetime pretending to be old enough to get the vaccine.
The UK's arsenal has been bolstered by the approval of a third vaccine, produced by Moderna. It won't be available for patients until the spring, but ministers are confident they have enough of the Pfizer and AstraZeneca to hit 2 million doses a week soon.
We've got literally between now and February, many millions of both vaccines coming through. I now have a much clearer line of sight for those deliveries, and therefore I can tell you that the NHS plan, I can tell you that it's challenging and stretching, but I'm confident we can meet it.
From Monday, Ashton Gate in Bristol will be part of that effort. The stadium closed to fans but open to thousands of patients after armed forces personnel turned the South Stand concourse into a field hospital.
It's fully compartmentalised, it's been turned sterile and clinical, if you like. The concessions, which would usually be pumping out hundreds and thousands of pies and pints, are now a number of pharmacies. We're very much looking forward to hosting it and be able to support the NHS not just in Bristol but nationally.
After months of mass testing for coronavirus, a more hopeful project is underway. If vaccines are going to catch up with the virus, then places like this will be crucial. Working 7 days a week, they hope to deliver 1,000 doses a day to people from across the southwest. But ultimately, this victory won't be won here, but in hundreds of GPs, surgeries and health centres across the country. Ashton Gate is one of 7 mass vaccination centres in stadia and conference centres across the country. By the end of next week, 223 hospital hubs in England will be vaccinating NHS staff and patients. But the majority of doses will be administered locally by GPs and pharmacists operating from more than 1,000 locations by the end of next week. Ensuring supplies reach every part of the network is key, and it's been a patchy start. But at the Greenbank Medical Practice in Oldham, it's so far so good.
I think it's been very positive. There has been teething issues, and we had a week to set up, so there were some blips that we endured in just before Christmas, but we've been able to smooth out those issues. There's better IT systems on board now, and there's an appointment booking system.
To vaccinate almost a quarter of the population in 6 weeks, every part of the system will need to work. Lives and the return of normal life depend on it. Paul Kelso, Sky News in Bristol.